Hi, good afternoon.
Hi, how you doing? Let's see. Let me try this. I'm like, this room is so dull. I'm done calling. Hello? Hello? I'll be back, Tiffany. I'm trying to set up. I'm in a hotel room and it's no light. I'm trying to set this up.
No problem at all. Take your time.
I wondered why you ran. Why is this light not coming on? I thought you were. No.
Mr. Robinson that is joining us. We're gonna give it like 1 more minute, maybe. We are waiting for one of our presenters to join us. And then shout out to Dr. Jacqueline Jimenez Palanco. Shout out to all the amazing Montefiore students, doctors, I don't know, that have joined us. That is great. I think Ms. Dubon-Yard said that we had close to 200 registrants. So that's exciting.
And we're at 117, 118 and counting.
Ooh.
In this space right now.
Okay, since so many of us are on the Google Doc, I am actually gonna present from PowerPoint. So if you're joining us, I want you to know about a dope website that I found during Black to the Future had a COVID town hall last night. Was really, really interesting. Kenyon Farrow, other amazing scholars were there, but I found that Run DMC actually created these interesting videos about COVID. So why don't we get started by watching part 2. I kind of played part 1 when you were listening, but I'll play part 2. YouTube won't ever let me be great. Can you see the video or do you still see my screen?
No, we can see the video. It's just the sound. Oh, now there's the sound.
Got the vaccine. We can get back to normal. Let me inform you. Let's all get the vaccine. It's about community immunity. I'm talking unity for you and me. If Doc says it's good, then trust me, it's good. Now let's all get the vaccine. All right. Trust me, believe me, we're not gonna have another Tuskegee. This ain't eugenics. No way. Nobody getting away with hiding information today. Got the FDA, CDC, black doctors and experts for you and me. There's a whole lot of data for the world is free. Do me a favor, check it out and you'll see. I gotta give a shout out to all of those involved that's helping us get this problem solved. People wanna know, is the vaccine safe? It doesn't have anything to do with race. 9 out of 10 people won't get sick. That's 90% effective and legit. We gotta act now. Please don't wait. Get the vaccine before it's too late. For real.
I'll take your seat.
So, okay. Yeah, I thought that little video was cute. I wasn't sure if I was gonna show it because remember in middle school and like high school when like teachers would try to like stunt like they were cool and show videos and you were always mortified by the content, right? I was afraid that we were gonna run into to that, but I like the site. It has a lot of culturally responsive resources that I think are pertinent to our discussion today. And so that's why I wanted to start with it. Okay. I'm gonna skip and share. 5,000 people are also texting me right now. So forgive me as I navigate this. Okay. So let's get started. I am Dr. Monique Antoinette Guichard. I am a faculty member at Bronx Community College. I am only going to say that about myself. And I want to introduce you to the wonderful panelists that we have this afternoon. Let's go on the Hollywood Square. Rennie?
Ma'am. Hear me? I'm good. Hi, everyone. My name is Rennie John. I am a BCC graduate. I'm a CUNY graduate overall. I went to BCC, Kingsborough, and graduated from Brooklyn College. And last year, I got my Master in Public Health from Cornell University. So nice to meet everyone, and I'm glad to be here.
Reverend Dr. Phillips?
My name is Reverend Dr. Lula Mae Phillips.
Dr. Phillips, we can't see you.
Oh, okay. Okay, I got it. You see, well, I'm moving because I'm in a car. Can you see me a little bit?
Mm-hmm.
Oh, okay. My name is Reverend Dr. Lula Mae Phillips, and I am a graduate of CUNY. I went to City University of New York. I'm a pastor and a minister, and I'm a registered nurse. And I love science and I love healthcare. And I work currently for Weill Cornell Medicine Clinical Translational Science Center, which is really all about research and clinical trials. Thank you.
Thanks. Ivy?
Great. Hey, y'all. Ivelisse or Ivelisse Andino, Bronx native BX all day. Also, yeah, excited to be with you all and just to chat and keep it real and kick it today.
Thanks. Dr. Watkins?
Hello, I'm Julian Watkins. I am not a CUNY grad. I went to Howard University, but I am a city medical specialist and internal medicine trained doc at the New York City Department of Health and Mental Hygiene. Happy to be here.
We're excited to have you. Dr. Jones?
Hi, everybody. I'm Dr. Lucretia Jones. I am a CUNY graduate. I did my doctorate at the Graduate Center in Public Health. I work at the New York City Department of Health for 28 years, and I'm a Bronx resident in the same South Bronx neighborhood for 65 years. Thank you.
And last but not least, Dr. Brown.
Hello, everyone. I'm Dr. Justin Brown. I'm the Director of the Public Health and Community Health Program at LaGuardia Community College, a CUNY Graduate Center graduate as well, in Critical Social Personality Psych, and Master's of Public Health from the CUNY School of Public Health. In their first year, when they moved to to Harlem, and policy, healthcare policy and management is my area, with, again, a lot of work for many years teaching in the classroom. I taught at every single CUNY in the Bronx, and also doing other related work.
Thank you. I am delighted that you accepted my invitation to host this community conversation. So we're going to introduce ourselves a little bit more in depth in a second. But before we do that, we want to know who is in the space. We have a host of different folks. We want to go over some housekeeping rules. So thank you so much for muting yourself. Please take a moment to update your Zoom name. And please do include your pronouns. If you don't know how to do that, please go to participants, please find your name, please right click, and then you can hit rename, and then you can include your pronouns there, right? We want you to show up in whatever way makes you feel comfortable. Keep your camera on, turn it off, raise your hand, use the chat, make sure you have some water. We'll probably do a stretch break. Dr. Watkins and Reverend Dr. Phillips would probably advise that. We don't want you to be too sedentary in this space, but get ready for an interactive, what we hope is an interactive discussion where we promise not to talk so much at you, but we want to go over a few things. Okay, so our first poll question is, tell us who you be. Who are you? Panelists can't vote. Boo. Shout out to my social psychology students because I've taken over their class time and they are up in here. Maybe they are the 16%. Should I hum the Jeopardy music, Tiffany?
I do like your humming voice.
I forgot to introduce my amazing colleague, Miss Tiffany Dubon Yard, who is our Zoom everything. Our tech support, our organizer, Tiffany and I, in addition to some folks who are have joined us this afternoon, are part of what we call the BCC Social Justice Network. And we'll talk about them in a minute. All right, we're gonna stop the poll. Yay.
Okay.
So we have some CUNY students and we have other physicians and researchers, but our largest groups are CUNY students and faculty and staff at BCC. Thank you so much. Could you stop sharing that for me, please?
Sure.
All right, so our next poll question, I can't get this out the way, Tiff.
What's in your way?
The poll is still there.
You can just X it out.
Okay, I hit, yeah, you can close the window on your
Got
end.
it. I can't say coronavirus like Cardi. I was practicing last night. I couldn't get the twang right. Can you tell us, have you or someone you know, love, care about contracted the coronavirus? That's more yeses than I think we anticipated, no?
Mm-hmm.
It's a lot more yeses than we anticipated. 80% is.
Let me know when to close it.
Close it.
Okay.
Thank you. One last poll question. Have you or someone you know, love, care about received one of the COVID vaccines? I should be humming my derivative music. We'll let this one go till it's 80% too. Okay, that's pretty good. Can I just pause right here to say to the 31 people who said, no, I don't have confidence and that's why I'm here. Thank you so much for being brave and speaking the truth. And for joining us and hearing us out. And we're super excited that you're here. Thanks, Tiff. Oh, shout out to Dr. Marilyn Aguirre Molina, Emeritus Professor of Public Health. Okay, great. So we've organized this as a community conversation. We're going to talk about what a community conversation, like what it is. We're going to talk about what we not finna do up in this space. We're going to introduce ourselves a little bit more, but we will also want to leave room to attend to like your spontaneous questions, concern, needs, that kind of stuff. Dr. Brown and I are going to use the chat to unpack vocabulary. Dr. Brown, Dr. Jones, but also Ivy and I are here in kind of like dual capacities, representing the institutions and organizations that we're a part of, but also representing an institution, an organization rather, called the Bronx Community Research Review Board. And one of the things that we do is try to help Bronxites get research and health literacy by not using jargon or unpacking jargon. So if you see us saying an experiment is, a clinical trial is, this acronym means, that's what we're doing, right? So please do use the chat. I want to acknowledge my colleague, Cynthia Suarez Espinal, who is going to help us moderate the chat. Thank you for being here, Cynthia. And without further ado, let's get it started. So I thought that I would bring some amazing public health scholars into this space. And I just want to share this brief clip by Dr. Kenyon Farrow. This was recorded March 2020, but it's very prescient. Is that how you say that word, Dr. Brown? Prescient? It's like he knew what he was going to talk. He knew that he was forecasting some stuff that's going to happen. So let's listen to Dr. Farrow just for 2 minutes.
Most infectious diseases, they tend to travel the routes of in any society. If we already look at what we know about just some of the risk factors in terms of senior citizens and people who have some underlying kind of health issues there, we know that there are racial disparities in, in diabetes, for instance, in hypertension impacts African Americans and Latinos in this country, and in heart disease. So we may potentially over time see some real racial stratification in terms of who is impacted. And also just given that so many workers who are unable, say, to, take off because they're in service industry jobs, tend to be more Black and brown folks. One of the things that came out of the AIDS epidemic is that it did bring people together in a moment where things were really unsure, to really take care of one another, but also fight like hell to live. And if that meant, fighting the government, the hospitals, public health, researchers, pharma companies, people fought. And so I think we need to kind of carry that same spirit in thinking about what it is we need to do to take care of our personal selves and also our loved ones in our just larger community. But also, what does this expose about the kinds of things that we don't have in place as a society that will prevent this from happening in the first place? So we should be fighting like hell for paid sick leave. We should be fighting like hell for Medicare for all. We should be fighting like hell for lower drug costs. We should be fighting like hell for people to have, access to these things. So I think we have to think about all of this kinds of infrastructure that we, don't have in place, that this virus exposes, that we take care of one another and continue to fight for our lives.
Thank you, Dr. Farrow. Okay, I'm going to start sharing my screen again, but this Zoom life here. Do we have any questions in the chat so far? Or are we good?
Nothing yet in the chat.
Okay, good. We're also gonna try to do a good job of sharing citations, right? So if you don't know who Kenyon Farrow is, please get your life and Google Dr. Kenyon Farrow. I'm just saying. He wrote a beautiful piece on incarcerated folks and COVID in Medium, I think, that folks should really read. Dr. Brown, can you help me read this slide about why we organized this conversation?
Certainly. From a piece by Baja and Stanford, the quote, framing the conversation about distrust in COVID vaccines in terms of everyday racism rather than historical atrocities may increase underserved communities' willingness to be vaccinated. When we hyper-focus on Sims, Lax, and Tuskegee, we ascribe the current Black health experience to past racism rooting our present in immovable historical occurrences, and undermining efforts to combat mistrust. Everyday racism, by contrast, can be tackled in the present.
Thank you for that, right? So Dr. Brown just dropped a couple of like important historical like things that we should know about, right? So I guess before we continue, when Dr. Brown mentioned Sims or lax or the Tuskegee syphilis experiment, do folks know what he's talking about?
Yeah.
I can't see the chat. I'm gonna pretend I can see the chat.
People are saying yes, some are saying no.
Some are saying no. Okay, so what we're gonna do, so this, when we get to the breakout rooms, we're gonna share the PDF for our Google Slides that has a hell of a lot of resources, including the scholarship that we are citing as we have this community conversation. But I wanted to add like another point to it, right? So I asked Dr. Brown to read that quote from a recent paper on vaccine hesitancy / confidence / redlining, right, / a whole bunch of things, because some of us are really uncomfortable with this notion that like Tuskegee is the only example of egregious abuse of Black folks in research, Black and brown folks in research. And that is not true, right? It'd be interesting to like think about colonization, chattel enslavement as like the beginning thing, that whatever, but we want to get folks to also talk about Elijah McClain and Dawn Wooten and Esme Green and Dr. Susan Moore, right? Those are recent, and I could have filled this entire community conversation on examples like that. Really quickly, does anyone know what happened to Esme Green? Esmond Green, I'm sorry.
The chat is saying no.
The chat is saying no. Esmond Green was a Caribbean American woman in Brooklyn who went to the hospital for some help, and she ended up dying in the hospital waiting room, right? Does anyone know what happened to Dr. Susan Moore?
You're saying
Getting a couple of no's, yeah.
Oh, my students are not saying no, because I'm side-eyeing y'all. We're gonna have a conversation.
no, not your
in that class.
I mean, maybe some people are just saying no, so you can go ahead and explain it anyway.
Well, maybe one of the panelists can help me talk about, what do we know about Dr. Susan Moore? You can unmute yourself, Dr. Brown.
Dr. Moore was a physician, I believe, in Indiana, who went to the hospital with COVID. And while she was there, she was receiving subpar treatment, or wasn't receiving the right treatment, and was asking for better care. And the people who were supposed to take care of her felt intimidated by her and described her actions as intimidating, trying to fight for her life. And she ultimately died. And the hospital basically blamed it on her for being so, quote unquote, aggressive.
Mm-hmm. So thank you for helping me explain what happened to Dr. Moore. And we're bringing that into the space because sometimes when we have conversations about how Black folks are treated, people conflate it and talk about it's only poor and working class Black folks, right? But it doesn't, our education, our social status doesn't matter, right? We disproportionately are discriminated against in interactions in the healthcare system and research. And we'll talk about things like that through our community conversation. So we are gonna have these 3 breakout rooms, and I promise, we're gonna talk about ourselves and a little bit more, but I would like to ask Dr. Jones and Dr. Watkins to tell us, share a little bit about the most recent stuff that we know about coronavirus in the Bronx and the city.
Hi, everybody. Julian, I don't know, I can start with the stats, or would you like to give a little background on COVID first?
You can start with the stats.
Okay, so everybody, as I said, I work at the New York City Department of Health. In my day job, I'm the director of the General Surveillance Unit in Communicable Diseases. Now that we're activated, I oversee a staff of about 350 public health nurses, public health advisors, epidemiologists, research scientists, and all who conduct surveillance for COVID. So if any of you out there, I'm sure you got calls if you tested positive from people asking all these questions and you want to know why, they want to know all your business, it's probably my staff. And the reason we ask these questions is because we're trying to find out exactly where is COVID, who's getting it. We ask race information, and I know a lot of people have issues about certain questions, but unless we know where it's at and in what communities, you know, in especially small communities, people of color, trans. So we have to ask these questions to see where COVID is. So these stats here, I'm not going to go over it in detail, but I just want all this information I shared on our resource list, this website. This is from the New York City data website, and it shows by communities in the Bronx, the percent positivity. So that means of everyone testing, how many people are testing positive. So these three columns are from just February, the last 3 weeks. And these are percentage. So just briefly, you can look at it after. I just want you to see. So if you look at the white neighborhoods in the Bronx, if you look at like City Island, where they're, yeah, thank you. The percent positivity is only 6.4. And then you look at some place like, let's say, I think it was Fordham, Kingsbridge. Let me find where that is. That is about, 12. So that's twice as much. So that community there in the Fordham section has twice as much COVID as, say, City Island. And the same is true. So like Allerton, Fieldston, they have very low rates, but Hunts Point, Parkchester, and that's what we expect in communities of color, that the rates are going to be higher. And for lots of reasons, because especially in the beginning, our communities work these jobs where we can't work. Everyone is not as blessed to be able to work remotely. So if you have the job where you have to go out, ride transportation, you're at higher risk. So that's, I just want to give you, here is a map that also shows it. So the darker the color of the zip code, the higher the percent positivity. So you see, look at Hunts Point jumps out. That's my neighborhood. I'm Longwood, Hunts Point. The 104.74 is very high, as well as 104.53 and 6.8. So that's why we collect this information. And then maybe Julian could talk a little bit about the vaccine and how clinics set up to especially target these neighborhoods that are most impacted by COVID.
Do you have the bigger citywide map? Oh, okay. Well, thank you. So yeah, all of this data is available on the Department of Health webpage, and you can click, it's interactive, so you can hover over the zip code to compare. But basically, if you blew up that last image with the red, you would see the dark red, and all of the Bronx is dark red compared to other parts of the city. Manhattan is a lot under. I think a good reference is to know that across the city, there's about 8% positivity. So about 8 out of every 100 folks across the city are testing positive. But as she said, you know, in some parts of the Bronx, folks are testing 12 out of 100. And this map kind of is like the inverse. So it's in the green represents higher percent of folks being vaccinated, and it's the opposite. You can see the Bronx is pretty light compared to Manhattan, which is pretty dark all up and down. And that just represents higher numbers of folks getting tested. So that's the thing. So people aren't being tested as frequently in the Bronx, but when folks are getting tested, more folks are testing positive. Is there another slide?
There isn't another.
Okay. I can talk a little bit about the vaccine efforts. So very early in the pandemic, a lot of folks in the health department knew what was bound to happen. We were been advocating since the very early days, like, look, certain neighborhoods are still reeling from the HIV crisis, reeling from all these other crises, and we just knew that more communities were left more vulnerable. So there's been folks who've been advocating for real equity in the distribution of resources. Early in the pandemic, testing was one of the most crucial resources that was very limited. And so really, we identified a lot of neighborhoods across the city to really to really go out and canvas and bring mobile testing. That work has continued. We've been able to increase the amount of neighborhoods that we include in this focused outreach. And when the vaccine was made available, we were activated to also advocate that these communities also get the vaccine resources. So there were some efforts with city agencies, but also with the state and federal government to open up some of these mass vaccine centers in boroughs that were hit the hardest. So I know a lot of folks may be familiar with the site, a couple sites in the Bronx that are focusing on seniors now, but eventually it should be a mass vaccine site for all Bronx sites.
Can I ask a clarifying question?
Sure. Yes. Can you identify yourself and please take a few moments maybe to rename yourself? Go ahead.
Before I ask the question or after?
After you ask the question, can you rename yourself? But go ahead, ask the question.
All right, in that previous slide where Lower Manhattan had the darker areas, I guess those are zip code areas. Do the testing sites there limit who can visit those testing sites? Meaning, can people from the Bronx who work in Manhattan who find it convenient to go to those testing sites visit there, so that when they go back home, they could just go home and not have to visit a testing site in the Bronx, for instance?
You can be tested. Oh, sorry. Did you say your name?
Nana.
Okay. You can be tested at any site in the city, but the data that the city gets back, it's by where you live. So people who live in Manhattan are getting tested more than people in the Bronx. But that also is a fact. A lot of folks get tested around where they live. So it's access, and it's also the frequency that folks are getting tested.
Okay, so just to be clear, the darkest spots means that's the people who got tested, that's where they live, basically.
Yeah, those are like the zones, yeah.
All right, thank you.
Thank you for asking that clarifying question. Okay.
Dr. Guichard, there's a question in the chat. Will the COVID-19 data get included in the next community health profiles?
I would think so. I'm not involved in that, but it would have to.
Yeah, and I think online now they call it community profiles, where they break down, if you go to our website and you can look by borough and neighborhood. So I'm sure they will do it in the actual community health profile.
So when you registered, we have your email. We're going to share a copy of our slides. We're going to share a hell of a lot of resources. We will hold Dr. Watkins and Dr. Jones accountable to giving us an update on that. Okay. So I want to remind us that this is a community conversation, right? And really briefly, because my social psychology students are here, community conversations, dialogues, forums, or whatever are a research method that lots of psychologists, public health, other disciplines use to have conversations with folks impacted by an issue or a problem, right? We are gonna respect and care and love on each other in a community conversation, right? We're not gonna shame folks for having whatever questions that they have. We're not going to shame folks for perhaps harboring non-scientific views about vaccination. We are here to provide some education, right? And to make sure that you have the facts that will inform your conversation, your decision rather to be vaccinated. We're not going to permit any gaslighting in here. We're going to respectfully hold space for disagreement and what we call complex personhood, right? Some of us are complex people, if that makes sense. But we're going to introduce ourselves, and then we're going to explain the three groups that we're going to jump into, and then we're going to come back and have a conversation across the groups. All right.
Dr. Guichard, there's one more question. I'm so sorry.
That's okay.
There's a question. Can the vaccine be specifically distributed to the zip codes to the high outbreak neighborhoods?
Well, I guess I can answer that. I know, that was a big problem I'll speak about after, because I've worked at the DOH site in the South Bronx, and most, 90% of the people coming there were from people outside of the borough and outside the communities. And so now they set up like Yankee Stadium specific for the Bronx, and some churches in the Bronx or specific zip codes. And I believe those are zip codes that were identified as being high. So even though I'm in 5-5, and one of the churches was not far from me, I was not included. 10459 and other zips were, and that's where the high rates were. So they're trying to target. They also have, I believe, mobile vans going in. They have some sites specific for NYCHA residents, some for seniors. So they're trying, and Dr. Watkins could probably talk more about the equity issues in trying to target resources to the people who most need it.
Yeah, you covered it, but basically they are doing targeted outreach. There's just a couple of main limiting factor, which is the supply. And there's actually issues with the way that the vaccines are stored, because they're not very mobile. They can't be shaken, they can't get a certain temperature, or else they become ineffective. So unfortunately, those limiting factors of not being able to, like, you can't put them in a backpack and go door to door and go and vaccinate people. It wouldn't work anymore, because it's that fragile or unstable. But then there's also just the supply, because there's just not enough, and they're not making it fast enough to really open up sites, because the supply is so low.
I appreciate that. We have a couple of more nuanced questions about vaccination that we're going to get to in the breakout rooms. Dr. Watkins and Dr. Jones, I've also heard that like recent bad weather has delayed getting vaccines out to the sites, and that I guess early on when there was the vaccination started happening, they were vaccinating people as they came and not reserving the second shot, but now there's a reservation for the second. So I guess that explains some of the difficulty folks are having as the eligibility groups open up. You still can't get an appointment, right? Because they're still waiting to give the second dose to a lot of folks.
Yeah. So
Yeah.
it just kind of highlights how interconnected everything is. The storms that happen in like in the Southwest and middle of the country, all of that affected the vaccine supply. So the city gets a supply once a week, and that last week's supply didn't get here until this week Monday. But luckily we got this week's supply on Tuesday. So you guys should see a lot of appointments for folks who are eligible that should be opening up in the city. What was the other part?
Well, I also want to say another issue while you're thinking, Julian, is that the technology, that is a big problem. A lot of people of color and people that don't have the technology. And we're talking about, it was hard for me to navigate, to get appointments. And so, we changed our app and it's supposed to make it easier, but it's hard for everyone who doesn't have a smartphone or can use and have access to, I couldn't believe that they didn't have a number in the beginning. That was like an afterthought, to have a number where you could call to set up an appointment, but you couldn't get through. So technology was a issue with getting it as well.
Yes.
That kind of like marginalization in action, where they kind of just ignore the fact that so many people are not tech savvy or don't have access to the tech, or the reservations, or the fact that at first they weren't able to reserve vaccines for people living in the areas, and it was just first come first serve. But now there is, now this is something that they're working on. They're able to actually target and be very intentional with what they're doing. It's a work in progress to get them to be intentional at all times, but we're working on it for sure.
Yeah, I appreciate you. I would also say, Dr. Jones and Dr. Watkins, that even when you're tech savvy, some of the systems, I won't say the system that I used yesterday, but I called Dr. Jones on the phone because the system asked me to take a front and back picture of my insurance card and a front and back picture of my partner's ID. And I did on an iPhone, right? Smart, I'm tech savvy, right? But it saved it in HEIC format, and the site kept rejecting it. So it doesn't matter if you're tech savvy either, right? I wasn't able to make the appointment. We're gonna briefly introduce ourselves and introduce the in 1 minute increments. And then we're going to describe the breakout rooms, and then we're going to get you into these rooms because I realize that we're running short on time.
And there are 3 questions in the chat. I don't know how you wanted
We're
to
going to
address
press pause on
those.
the questions for 1 second
Got it.
while we get through the
Okay.
introductions. Thank you, Tiffany. Ivy Elise.
Hey, y'all. Hi. I might not be on the screen, but can y'all see me okay? Yeah, great. All right. So Ivelisse or Ivelisse, a little bit about me. I am many ways just, a community builder. I said it earlier, born and raised in the Bronx. For a long time, my background was actually, I wanted to be a doctor, and I found out real fast, real quick, that that wasn't necessarily the easiest thing to do. I showed up at Lehman College like, hey, I'm gonna be a doctor, and didn't realize there was a lot of stuff to get into that. And so that was my first kind of introduction to like healthcare and the healthcare system. It's complicated. Even when you are in the industry, it really isn't easy to navigate, but it also isn't fair or equitable. So I've spent my career building a company. So I'm also the CEO and founder of Radical Health. And what we get to do there is really look at health and healthcare and try to make it simple and equitable and do so in a community-led way. So we built out a Know Your Rights for Health app where you can ask questions and know what questions to ask. We do a lot of conversations and using circles to bring people together. And essentially, we're just trying to change the healthcare game. It's one that is built with us and maybe even reimagined, because right now it ain't really it for all of us. And in doing that, I get to do so at this intersection of community, health, and technology. So I'm also the first Latina-owned public benefit corp in New York. So I am in many ways in breaking the standards. I am part of the 0.01% of Afro-Latinas in health tech that sit at like the C-level. So basically, my job is to shake things up and to let you know that wherever you are, you've lived with this experience, you can do the same thing, no matter the letters after your name or where you come from or what you've lived through. And I get to do that in some official capacities as well. I'm also a commissioner for the New York City Commission on Gender Equity. I get to sit on the AMA, American Medical Association's Health and Equity Innovation Advisory Board. And amongst all these fancy titles, more than that, the one that's the most important to me is I get to live in community and do work alongside some of the dopest folks, some of who are on this panel and in the audience, and really day by day with my neighbors. So I'm really excited to be here, and hopefully we can chat, and my email's here. So if y'all want to kick it afterwards, feel free to send me a note.
Shout out to Ivy for organizing Uber rides for folks who wanted to get vaccinated. Dr. Brown, 45 seconds.
Good afternoon, everyone. I'll be really brief and short, but similarly, as I mentioned before, I want to also thank my colleagues and friends and mentor, also here, Dr. Aguero Molina, and from the CUNY Institute for Health Equity, in part that really kind of helped push me in the direction of the work that I found so central and important to what I do. And also others from Manhattan's Staten Island Area Health Education Center. Most of my work has been, within communities, working with communities and after-school programs, really to kind of identify and address health inequities, particularly those faced by Black, Indigenous, people of color, LGBTQIA, and also youth. Really with the purpose to highlight and address the systemic and contextual issues in our lives, from experiencing racism, institutional racism, to also figuring out and seeing that ways we can intervene often around what we call the social determinants of health, may be other avenues through which alleviation of the inequities that we face, whereby it's really these policies, these practices that are kind of create the structure around us so that we are unable, right, to really have and reach the optimal health and well-being that we all deserve individually and within our communities. So, but I will leave it there. And just again, thank all of you for being here and as we continue to this very important work.
I will unmute myself. I will be brief. I'm Monique Gashard. I'm actually not here in my role as a BCC professor, which is strange, right? I'm here representing the Bronx Community Research Review Board, which really quickly is a group of volunteer Bronx residents, Bronx educators, Bronx researchers, and caregivers who want to, as Ivy noted, shake up the culture of top-down research in the borough of the Bronx, right? The way that we see that, right? I'm a Star Wars fan, so forgive my references. Like the way that we blow up the Death Star, the way that we blow up the Death Star is by pausing to make sure that Bronx residents understand the terminology and language of research, right? And then we paused. So we had this Community Engaged Research Academy that we hosted for 2 years. Our hashtag is no more research about us without us, right? And we take that very, very, very seriously. We are in the process of becoming an independent community IRB, because right now, well-intentioned researchers hit us up and say, I want to do this study in Hunts Point. I want to do this study in this community or whatever. And they come to us for advice about how to more ethically and culturally engage with Bronx residents. But sometimes we review stuff that is racist or sexist or transphobic or not as inclusive as it should be. And so we want the capacity to also be able to provide some regulatory oversight and shut those studies down. I'm on the Community Advisory Board with Reverend Dr. Phillips at Weill Cornell's Clinical Translational Science Center. I am a Bronx resident, but I am not a Bronx patient, right? I tried with the systems that we have, no shade, well, maybe shade, right? There are some amazing doctors at Montefiore, Einstein, Jacobi, or whatever, but I was sick and tired of being in a system where I had brilliant doctors, but the system was failing me as a patient. So there's a lot of Black scholars who have written about this. All my doctors are in Purchase, New York. So I get on the Metro North, y'all, and go to gynecologist, PCP, all those other things. So in the breakout rooms, I'll talk about that. Rennie.
Hi, everyone. My name is Rennie John again. So I am currently a contact tracer. So I've done over 800 home visits since the start of pandemic. I've been working with health and hospitals and also with New York City Department of Health. I got my start at BCC. Thank you, Dr. Hella, who's on the call, and Dr. G, I don't want to butcher your last name, like I always do, for putting me in that direction. I've worked with Mo, I've worked under Lucretia. So currently, like I said, I'm a contact tracer. I've done home visits to positive clients, to positive cases all over New York City, from Staten Island all the way to the Bronx. And I work also at the testing sites 3 days a week, where I also deliver positive results. I call folks and try to link them to any kind of services they may need while they deal with COVID, from food services to any kind of doctor services in regards to food, prescription being delivered to their household, and also linking them to hotels. So part of the program is linking folks to hotels who may be living with other folks within their household and may not have enough space. And we get that done. I get that done on a daily basis. Today's my off day, that's why I'm talking to you guys. So like I said, I've made all these home visits, from people coming through the airport to people that's been positive at the testing sites. So I've gotten a lot of work done. I've been working heavily during the pandemic. I seem to always work during outbreaks for the last few years. I've gotten a lot of my public health work. I am not from the Bronx, but I've done a lot of work in the Bronx. I'm from Brooklyn. I know we got some Brooklyn people in here somewhere. And I just wanted to shout out that. And I just want to thank Monique for inviting me to be on this call. Like I said earlier, I graduated from Brooklyn and then went on to Cornell. I actually got my MPH degree last year, and I started working on the pandemic before I even got my degree in August. So thank you for that. And thank you for, just want to say thank you for being here.
Thank you for spending your day off with us. Dr. Jones, we got a little bit faster.
Okay, I'll be brief. I just want to say, I've already said about my DOH work, but I'm here in my other capacity, my other hat. I first met Monique. I just want to shout out to Dr. Mo 20 years ago when she was doing participatory action research in my organization, Mothers on the Move, where I was the founding chair about 30 years ago. And she started working with my daughter and son around oral history project. So it was great meeting up back with her some years ago and becoming a part of the Bronx Community Research Review Board. That is my passion now. Like Monique said, it's like a community IRB. I went through the Community Engaged Research Academy as a student. I learned more from this program about real community work than I did in my doctoral program at CUNY, I hate to say, but it's true. Also, I'm a community activist. Like I said, I've lived in the same house I was born in 65 years ago. I love my South Bronx and not moving. So with Mothers on the Move, did a lot of work on environmental justice, failing schools, and all other kind of social injustice. And I'm just happy to be here and thank everyone for joining us.
Is Reverend Dr. Phillips still with us? And everyone has 5,001 meetings. So Dr. Phillips only had like 45 minutes. And hi, Dr. Phillips.
Hi, I'm here for the next 5 minutes. So
oh, no. Okay.
Sorry, I have to leave you guys, but I just wanted to say, I do community engagement and research manager at the Weill Cornell Medical College and Translational Science Center. I'm very, very much committed to community people understanding science, understanding research. My passion, I'm passionate about community people understanding research and knowing the value of research and understanding the words. So one of the things I've done right now is I've created the Community Research Academy that I will send you, and Dr. Mo teaches a session for us, exciting session, and all of the young people that work with me and all of the professional people that work with me as well listened to her presentation and they were just taken back. It was so empowering. So many people learned so very much. And when I tell you behaviors changed, I mean behaviors changed at the CTSC from her presentation alone. It was really positive. Everyone enjoyed it. But I also want to say that one of the other things that I do is I get, when people are doing presentations for the community, I review those presentations. I review COVID presentations. I review talks that the interns are giving. I review talks that NPs, MDs are giving. I review those talks to make sure that community people can understand those talks. Otherwise, having a talk where people do not understand the information is a waste of time. So one of the things that I do is I try to make sure that when people are giving information, it's the community can understand that information. Otherwise, we're wasting our time with all of our presentations and all of our talks. They're just good for insiders, but they're not very good for anyone else. So I hate to leave you guys.
That's okay. We'll miss you and I'll share your information. Thanks so much, Reverend.
Okay, thank you. Bye-bye.
Bye. Last but not least, Dr. Watkins, and then we're gonna get these groups popping.
Let's do it. I'm a doctor at the health department. I'm a cultural health leader with the Robert Wood Johnson Foundation. And my big passion is changing systems to be better and changing narratives about healthcare and the way that we look at equity. That's it. Let's go.
Thank you. All right. So there are going to be 3 groups and I'm going to ask Dr. Jones to join Dr. Watkins just because we lost Reverend Dr. Phillips, right?
Oh.
So in group 1, join that group. We're going to randomly assign you to groups. Group 1 will be talking about the science behind the vaccines. If you have questions about side effects, if you have questions about how fast, quote unquote, these vaccines were developed, if you have questions about preconditions, please ask them in that group. In group 2, me and maybe Justin, I'm going to steal you, Justin, because Ivy has a meeting too. We're going to talk about vaccine redlining, right? Shout out Ayanna Presley. We're going to talk about vaccine hesitancy and vaccine confidence. We're going to talk about personal experiences getting vaccinated, and we're going to talk about the role of Bronx-based organizations advocating for our folk. This is me and Dr. Lou getting vaccinated. We wanted to show you examples of people getting, I'm feeling myself because I got vaccinated. And if you want to know what the 914 means, it means I have a hell of a lot of allergies and I'm a bubble person. And I had physicians and doctors watching me for any reactivity for 45 minutes after I was vaccinated. Okay, and then in group 3, if you have questions about, like the questions some folks asked about how this data is collected, why it's collected, what information it's stored, and careers in public health, you're gonna talk to maybe Rennie and Dr. Brown. Let's get these groups popping, please.
All right, give me a second because now that presenters have changed, I have to move people out of certain
I can do
rooms.
one by myself. You don't have to move Dr. Jones.
So everybody?
Okay.
Okay, so what's happening now is everybody's been automatically put into a breakout room. Okay, for all of the presenters in your breakout room, you will have the ability to share your screen. You'll have access to the chat and share things via the chat. Okay, if anyone has any questions for your presenters in your room, please put it in the chat or whatever way they would like to have this conversation happening. If you need my assistance for anything, there will be a button in your room that says ask host for help. Just click on it. I'll get the message and I'll pop in and help you with anything. Okay. We all have 15 minutes in this space. So I'm opening up rooms now. You'll see a dialog box open on your end. Please make sure you hit OK, or you'll just be automatically whisked away.
Hi, Tiffany. Would it be hard to switch me over to?
I will switch people over. I'm going to go into every breakout room to make sure that the presenters that need to be in there are in there. And if they're in the wrong room, then I'll switch you over. So just go into your space and I'll move you.
Perfect. I'll just pop in with Dr.
Okay. Okay, just making sure everyone's still accepting their breakout rooms.
And answer them.
Really quickly, I'm just in here to make sure that you have the right people with you, Monique. Did you need me to move a presenter in here, or do you have?
Maybe Dr. Brown.
Dr. Brown?
Yeah.
Okay, so I'll look for Dr. Brown to bring them in here, right?
Yes.
Okie dokie. See you.
So Teresa, I've heard that a lot of folks have reacted like they felt like their immune systems got jolted, right? And that is to be expected. When we go back to the large group, right? I think that that is definitely a question about like the physiology and what those reactions mean. That's more pertinent.
I'll follow up with that.
Hi, Dr. Watkins, just checking in. Are you all set in this breakout room? Did you need me to move anyone in here with you, or are you good?
I'm fine.
Good? Okay. All right.
Someone's typing.
Or the appointments are gone by the time they get someone to help them. I had so many people like walk up. I was on St. Anne's Avenue at the South Bronx High School location. I was the manager, operation manager, coming up and wanting to get vaccinated without appointment. So in the beginning, I was able
to. Are people in here needing help getting into their breakout rooms or being assigned to one? Angelica, Shanaz, Akua, Oni, Nicole.
No, it's okay. So can we leave this room? Can we leave the meeting now?
Well, they're in breakout rooms right now for 15 minutes, you know, having their conversations, and then they'll be coming back into the space. Did you not want to participate in one of the breakout sessions?
Well, I just have a question that I was going to find out if the vaccine is mandatory.
Oh, I mean, the room that you should go into to ask that question would be room 2 or 3. Do you want me to put you in one of those rooms?
Okay.
Okay,
Thank you.
No problem. Give me 1 second, Angelica. I'll put you there. Okay, I'm putting you in a room, Angelica. You should see something pop up on your screen, okay? Anyone else? Shanaz, Oni, did you need assistance?
Google, you can Google it, then they kind of explain it. It's called a vector. So they use a different technique, but it's a lot more stable, and that vaccine can be stored at like normal refrigerator temps and temperatures, and can be like moved around like in a backpack or something because it's more stable. Do long haulers still dealing with the after effects of their COVID infection seem to have just as good as protection? If I was a long hauler, I would definitely get vaccinated again because I wouldn't want to get reinfected. Understanding that a lot of these symptoms from the long haulers, a lot of these are like what they're feeling are like I'm trying to think of the best way to say it. It's not that it's the COVID anymore. It's the damage that COVID has done that's affecting that's giving you these symptoms. Especially like some of the lung symptoms. There's a lot of folks who get like pneumonia from more typical things, who deal with like, difficulty breathing for a while. Understanding that COVID is not just a lung infection, it can cause inflammation all over. So that's why there's folks who are getting like chest pain, folks who are like getting strokes, who are getting blood clots in their legs. That's kind of that's why some of these long haulers are still having those symptoms. It's like the after effects, but it's not the virus itself that's just hanging around for that long. Is there a chart of this information with comparison of vaccine age and conditions? There's a lot of charts out there. There hasn't been like one in particular, but there are some like comparison charts so folks can see the ages, the breakdown of folks who were in all the vaccine trials. I think a good way to look at it though is because now we're in stage 4, we're like it's been approved, people are getting it by the millions. Now there's information, so it's been a little bit broader. So that with all of that more than millions and millions of folks being vaccinated, they're going to actually be able to kind of follow up and produce some information from what we know in the with the larger numbers, larger samples, which always is a more reassuring thing.
Where would I tell some of my seniors to go and find it? Because a lot of them, they want to get on, they want to look and find it. So where would I direct them to so they can find the charts?
To find the charts, I would say for someone who may not be like tech savvy and very good with Google, I would find one that I liked and I would share it with them. And that's kind of the advocacy that I do. Like I share like like some of the Department of Health data and things that have been created. Like I share those things to folks. So I don't even say, this is where you look. I just say, here, take this. So if you can like find something that you like and you think is like readable, it's like, here you go. Like take it, because it just make it easier. So if you find something that you like and you think is like user friendly, that's my advice. All right. Is there any more questions? Alfred, it appears that Moderna has a higher dose than Pfizer. So the schedules, so the people who created the vaccines, they set it up and they basically have like a recipe for immunity. So the people who had Pfizer, when they designed their study, they made their vaccine and they vaccinated folks. And then part of the study design, they are like, okay, we'll do the booster 3 weeks after. And so that's kind of how they did it. Understanding that you can get it you can get it up to 6 weeks after that booster, and it's still effective, safe and effective. But when they did the study, it was in a controlled, in a controlled setting, and that's how they set up that 3 weeks for Moderna, for Pfizer, 3 weeks for Moderna. The CDC was checking. They have research available for folks who didn't get it 3 weeks to 4 weeks, who got it up to 6 weeks, and they were proven to still have have the same levels of immunity. So that's why there's like the schedule, but there is some leeway because our bodies don't necessarily follow the schedule, but we know that people who have gotten it after have
Welcome back. Welcome back. We're just going to wait for the presenters and for everyone else to leave their spaces. Hope you all had a good time in your breakout rooms and gathered a lot of information. I know I stopped into Dr. Watkins' breakout room, and I was very happy to do that because I learned a lot in that. There were a lot of great questions that, thank you, Dr. Watkins, for your answers. I know it helped me because I'm definitely one that's like, all right, y'all can get shot up, I'll wait. But I think that a lot of the answers kind of actually gave me some more clarity and made me feel a bit more secure in my decision on getting vaccinated in the future. So thank you.
I mean, watch and wait is a very common stance that folks are taking, and it makes perfect sense. But I think there's, at some point I'm going to say, at one point will I reevaluate? And, over 1 million folks in New York City have been vaccinated, and there's not a lot of reports of, people having big side effects and people dying from vaccines. So that's reassuring. And then looking a little bit bigger, dozens of millions across the country. So at some point, as long as you're still doing your thing and wearing your mask, covering your nose and mouth, and trying to social distance, if you need to take your time, because I'd rather folks feel confident and go in and just feel like that's the right decision, to feel like pressured and like, oh no, I shouldn't have done it, because God forbid something, you do have a symptom that that is really uncomfortable. You wouldn't want to have you like, and now I got this. Now I got this. So yeah, if you're gonna watch and wait, as long as you keep doing what you got to do to stay safe.
Thank you.
Dr. Watkins, a lot of folks are gonna have their hand raised. Well, we need to do this again. That's the overwhelming thing that I've heard. We need to do this again for a longer period of time. We have a burning question about whether one should get vaccinated if you may be a long hauler, if you were hospitalized and sick.
Yeah, definitely. Because you wouldn't want to get this thing again.
But I believe, oh, sorry, go ahead.
Yes, my name is Terrence Brown. I'm the one who raised that question because I am a long hauler. And again, everyone's referring people to like myself, to my primary care physician. But the primary care physician that I have up in Westchester County, I also go to Purchase, as well as Bronxville, my physicians. They're saying that it's a choice that one has to make, because with a compromised immune system, where I have lung scarring and brain fog and all types of different medical issues, this is something that, again, is going to attack your immune system for you to build up antibodies, which I've already been told I have a lot of antibodies. But to pose that risk, especially hearing this stuff about second vaccines, and now you have these variants that the second vaccines, other than what Johnson & Johnson is saying, is not as, doesn't have the high level of efficacy as it does with the first strain that people developed these vaccines on. And I have yet to hear any reports of any studies done on people who were severely, contracted with, and hospitalized due to COVID. So without data to show that people who are in compromised immune, conditions as myself, poses limited threat to their current health, if not survival. I not to be morbid, but I had 2 small children under the age of 12, and I can't put myself at risk for a vaccine that I have yet to hear a study done on people in my condition.
I would say this. I would say with the data that so I'll say the long hauler thing. So what folks are feeling, they're feeling the symptoms of what the damage that COVID has done to you. And so understanding that it's not COVID that's still in your body for these months and months after, you're feeling the symptoms of what it's done. And what we do know about COVID is that it has caused this damage that you're feeling to this day, months later. And we also know that it's still just as deadly as it was at the very beginning. It's killing 2 to 3 out of 100 folks who get infected. That is the biggest risk to everyone's health right now, is getting COVID or being one of those people who gets it again. Someone who was infected and who dealt with some really some bad complications, to get infected again could be even worse. And so understanding that that's the biggest risk that we have to look at. When talking about vaccines, I think it's important to understand that vaccines can protect and offer immunity and prevent infection. And that's the biggest thing that you want. And I think understanding that the vaccine, there's millions of folks who've gotten vaccinated so far, right? And I think in the coming months, that data will be made available, but understanding that folks aren't dying from it. And it's like, what are the risks, right? And there's risks and benefits to everything. And understand that when you got infected, you were really sick and you had these symptoms, like the risk of getting COVID that first time, a lot of folks didn't make it, and getting it again, you may not make it that time. So it's just understanding that there's a risk and there's benefits. And unfortunately, the vaccine is new, right? It hasn't been around for years and years and tested as much, there's not years and years of testing, but we do know that it's safe and effective with the science and with the evidence. And now there's millions and millions of folks who've had it. And so if you want to wait and see, just make sure that you're covering your mask and taking your precautions. But just know that the biggest risk and the biggest concern to your health is getting that virus again.
And I just wanted to add something on what Julian said, that in our SERVEPI in the DOH, we have a study, we're looking at reinfection, and it's astonishing how many people we're looking at that 6 months out reinfected. So we know they were infected in the spring. And so we have a group now, maybe about 20 med-epis and some of my case investigators re-interviewing them to see, and they're doing sequencing to see if this in fact is a new infection, or is it still the same infection that they never rid? So people are getting reinfected, antibodies, they don't know, how long they last. And that's why vaccinations are important. But that data will not be out until we do that. And so I just wanted to put that out there, that a lot, besides that study, everything that we're looking at, it's still new. We're only a year out. So until we look at the, the impact and adverse events, we don't know.
I will say, I will say that also vaccines do not suppress your immunity. They actually just stimulate your immune system to do what it does naturally. Your immune system is working all the time because we are constantly coming in contact with viruses and bacteria, and our immune systems are just going. Just like your heart keeps beating, your immune system is just pumping away. The vaccine stimulates your immune system to make antibodies, these protective things, and a few other processes. The immune system is complex, but antibodies are the number one thing. But it's doing this thing to help your body be able to fight that virus if you come in contact with it, which is what you need. When folks get infected and they don't have antibodies, that virus is in there and it's replicating, it's going all over the place. And it takes your body a long time to develop immunity to even fight back. So the vaccine gives you that protection that you would need in case you come in contact with that thing. So it doesn't make you further immunosuppressed. It actually bolsters your immunity against this deadly virus.
So we're getting way more questions than we have time to answer. I'm going to start the chat, and I'm going to coordinate some answers that are shareable for everyone. I would like to thank all my wonderful scholar friends, amazing researcher, physician people for joining us this afternoon. But I would like to close by asking Dr. Watkins and perhaps Dr. Jones to talk to us about what should we do if we choose not to get vaccinated?
I mean, I touched on it a little bit. There's a lot of understanding that the decision to be vaccinated is very personal, and that we do not live one issue lives, and people have various reasons for not being vaccinated. And I think if you have your reasons, what you should do is keep doing what we've been doing. The things that got us through that first wave, we're getting better at them, right? So do the double mask. If you're not going to get that, do the double mask. Wear the surgical, put the cloth over it. If you're not going to get vaccinated, make sure you do that physical distancing. Don't go visit someone. Don't go inside someone's house. Don't go inside the restaurant. Don't go inside the movie theater. Like, keep that distance, and keep doing the things that we know, and get tested, regularly, and have the folks who you do come in contact with, make sure that they get tested. And I think that's going to be the best way that you can stay safe. And, everyone should be doing that, but especially if you're going to watch and wait, do it a little bit more so that you have that protection that we know works and has kept us safe this while. Do that. And then just ask yourself, what do you need to see, know, or hear to like change your mind on it, and just be open to revisiting it and looking at it again. And finding someone who you trust to kind of like, oh, okay, what's anything new? And I think those are the things that you can do if you're going to be a watch and waiter, which makes a lot of sense. So just make sure you do those safety things and keep your eyes and heart open, and consider the vaccine in the future.
Any last thoughts? I want to wish Terrence well. I want to thank you for asking that question. I want to wish there's some folks who just got over COVID that have joined us and have asked lots of questions. All the good vibes, healing vibes. I'm going to share a link to our presentation that towards the end has a hell of a lot of resources, but also tell you that we're probably going to add more to it. And I'm going to coordinate these wonderful folks' schedules so that I can bring them back, maybe for an evening presentation. So there's a link to our entire talk, including our contact information, sometimes our emails and our cell phone numbers, but also towards the end, you will see there are books that you should read if you want to know more about the history, the past and contemporary of structural racism in public health. There are great webinars that have more information that we've talked about. And they're all the resources from Dr. Watkins and Dr. Jones, but also Rennie, of like how to get vaccinated, how to get a hotel room, how to get food, all those things.
Well, can I say come quickly?
Sure.
For the last 2 weeks, I've been seeing a trend, and it's I've been having to tell families, entire families, that they're positive. I've had to tell 5 people in one family, 7 people in one family, 10 people in one family. And we just came out the holiday season and family gatherings, and even your family could give you COVID. We tend to be like, okay, it's my brother, it's my sister, it's my uncle, take off the mask. That's not so. I've been having to tell groups of families and do intakes for groups of families. And that's really important, that we tend to have a strong trust within family, which is, it's a family, but you also need to be vigilant and wear a mask, even though it's your family, and wear a mask even going out. I've traveled, I've gone to see my son down south, and I've worn my mask. So just because it's family doesn't mean you have to take your guard down, because I've been having to actually tell families that they are positive. So be vigilant.
Thank you for that, Rennie. I really appreciate it. Stay safe, folks. We promise there will be a part 2, maybe same time or in the evening. And thank you so much for spending some of your afternoon with us. Please be safe. Take care of each other. One love. Can I ask the panelists to hang out a little bit?
Thank you.
Can I ask just a quick question, Dr. Mo?
Yes, Professor Hart.
Several of my students have attended. Some of them let me know they were here, but will you be able to provide a list of the students so I can give them extra credit?
Yes, Professor Hart.
Thank you so much. I love you. I've made some comments. Please read them. Bye.
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 Thank you so much. Bye.
Bye, everyone. Bye, Dr.
Bye,
Monica Shagria.
Bye, Mr. Gina Woodfall.
Bye, everyone. Thank you so much for coming. This meeting will not close on its own. So if you are used to the meetings just closing up, please make sure you exit this one because we will not close it just yet.
Got you. Thank you, everyone.
Thank you.
Thank you. It was very informative.
You.
Have a blessed day, everyone.
You.
Do.
Mo, can I ask a question quick?
Yeah.
Is Dr.